What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, May 20th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and each of them carry a health risk to you. Want to stay informed with what's going on? Subscribe to my channel down below. Like the content you see today. Give it a thumbs up. The more people that hit that like button, the more YouTube shares this content throughout the algorithm. Of course, share these videos with anyone you know. And if you have any comments, leave them down below. Already, we have several news stories to talk about today. Then we're going to take a look at some of the stuff that we look at daily. And, of course, the weekly Walgreens update. Some wastewater, some CDC data, and we'll take a look at New Jersey and New York. Starting off today with this story about a cruise ship where more than 250 passengers taken ill after suspected vomiting bug outbreak aboard a cruise ship, reports say. And this is a ship that was leaving Southampton in the UK, and it left on May 11th. It was for a 14-night cruise around the Canary Islands. The cause of this is suspected to be norovirus. Now moving on to this. France. Circulation of COVID-19 in wastewater has been on the rise for several weeks. I did tweet out this full story. For the most part, it is paywalled, but hey, the headline is good enough. France is now seeing a rise as well for COVID-19. And speaking of international COVID rises, Spain hospitalizations for COVID-19 have quadrupled in 2 weeks. Significant increase in infections in Madrid and other communities. Hospitalizations are on the rise here. So this is not good whatsoever. Now moving on, that's the same story. Now moving on to this. This is something that I tweeted out yesterday. I did a little search and found this. At one point, this is back on December 14th of 2022, the New York Post, let me read what I put. At one time, the New York Post ran a story about where to buy masks online. Now we have yet another variant in 2024 and tons of other viruses running wild with no one caring. Yeah, pretty much the case. I mean, maybe at the very moment there's not as much COVID as there was at December 14th, 2022, but now we have all these other viruses running rampant, and as we talked about over the weekend, people are constantly getting ill. But where's the media telling you to mask up and telling you to stay safe? They're not whatsoever. They're just saying, oh, well, go out and you do you. Go out and live your best life. Meanwhile, people are continuously getting sick again and again and again after, keyword, after their COVID infections. Alrighty, moving on to this now. Just going to read a headline here. Bird flu found in western China as U.S. combats cattle outbreak. So now it's starting to spread in China once again as well. That's not a good thing. And moving on to this, a poll that I took yesterday. With other countries around the world rising for COVID, are you concerned that we are entering a new wave in the U.S.? 92.6% of people said yes. 7.4% said no. And as far as I can recall, and I have looked at some charts, I don't recall us going into a new wave entering Memorial Day weekend. So this is relatively interesting. We'll have to see where this heads because, well, just wait for Walgreens in a little bit. Obviously, if you get where I'm going here, yeah, Walgreens is not the best this week. Mind you, Walgreens doesn't do a lot of testing, but well, just wait a few minutes. Ohio. More deer are being found with chronic wasting disease. Further testing for chronic wasting disease in deer from the 2023 to 2024 season turned up 27 more white-tailed deer that tested positive. So this is something that is continuing to spread, and I will be adding this story. I'll make sure I'll get this story onto the website because we do have a section for chronic wasting. My website, datareport.info. It's an archive of information. I'll be archiving this story. All right, let's take a look at what's going on with today's pollen levels in the United States. And right off the bat, you see, in the Northeast, well, actually, no, generally from about Missouri on northeastward, quite a bit of red today. 38% of the country is in medium status for pollen levels, and high levels, as you can see here, Maine, New York, Vermont, New Hampshire, western Pennsylvania, northern Pennsylvania, Ohio, a good portion of Indiana, even portions of Michigan and Illinois and Missouri are seeing high levels today with moderate medium levels surrounding that. Medium levels in the Pacific Northwest, portions of the plains, medium today, but extreme southeast is not doing all that bad. And southern portions of California, New Mexico, and portions of Arizona, not terrible today. So that is good for you. Speaking of terrible, we have to take a look at the air quality today. As you know, there have been a lot of places lately that have been dealing with issues with the air quality. That continues to be the case. Texas, much of Texas continues to be really high levels. Wow, look at this place in western Texas. Look at that. 670? That's a really bad air quality. What is going on out there? What is that? Odessa? Yeah, what's going on in Odessa, Texas? Hope I said that correctly. Taking a look here, Oklahoma. Got some orange for you. Some orange in my area today in southeast Pennsylvania. Some yellows, more so yellows than orange, but there is some orange to be had back across Harrisburg, Washington, D.C. in the yellow today. Chicago in the yellows, even a couple oranges. And taking a look at what's going on in California. Usual hot spots, but not as bad as we have seen on some other days. Taking a look at severe weather from Storm Prediction Center. I have to keep you safe from this as well. There was a really bad outbreak yesterday that ended up a little bit worse than expected in some areas. Oklahoma had multiple tornadoes yesterday. They weren't really expected to see much tornadoes there, and they did, and there was some damage. We can actually go back and take a look at that real quickly. You can see here, yes, there ended up being 16 reported tornadoes. And that number could go up as they do storm surveys. And some of those tornadoes were not all in Oklahoma. Some were further to the north in Kansas as well. And looking at today, there's another risk of storms. Once again, this time in portions of Nebraska and in portions of Kansas where there is the threat of severe weather that continues for tomorrow. So if you live in these areas, please take this seriously, especially tomorrow. Illinois, Missouri, Iowa, Minnesota, and Wisconsin, please. Your tornado threat, it's there tomorrow. Wind, hail. Stay safe if you can. Heed all warnings. If you want to learn more about what's going on with the weather and climate, I have another Twitter where I do that called Climate Data Report. All right, taking a look at Philadelphia's EMS calls. I expected there to be a bit of a higher number today. I was listening to it yesterday. It was really busy. 814 EMS calls were reported yesterday. Taking a live look at what's going on in Montgomery County, Pennsylvania, and we see here, wow, not one, not two, not three, not four, but 5 cardiac emergency calls, and a bunch of other calls, 12 active calls right now, but concerning to see so many cardiac emergencies at the moment. And taking a look at Chester County, Pennsylvania, wow, really busy there. Let's go over these calls. Unresponsive person, stroke, syncope, injured person, heart problems, stroke again, sick person, emotional disorder, falls, seizures, respiratory difficulty, seizures, respiratory difficulty. Very busy in Chester County right now. Not a good thing to see that. Taking a look now, drum roll please, at this week's Walgreens numbers. It's not good. Walgreens says we are probably entering a wave right now. We are likely entering a wave right now. Current week's COVID positivity is 17.5%. The prior week was 15.3%. That's a difference of up 2.2%. Total test 3,697 versus 3,565. So testing even went up. And when you take a look at the chart here, I'm going to zoom this in, you can clearly see here, even if I didn't zoom it in, zoom it back out, you can clearly see here the positivity rates are trending higher once again. Let's take a look at a bunch of states. We'll start off here with New Hampshire. New Hampshire did not report last week. They had 0.0%, 50% versus 0, 4 tests versus whenever the last time they reported they had 7. New York State. New York State is seeing a legitimate rise. 27.3% positivity rate this week, 22.5% last week, up 4.8%, 132 tests versus 120. These are PCR COVID tests, by the way, or whatever testing they do at Walgreens. Taking a look here at New Jersey's positivity trend, This is not good at all. New Jersey, 22% this week. The prior week is 13%. Difference of up 9%. Total test, 150 versus 131. And I know right about now, someone's getting ready to type on their keyboard, well, it's only 150 tests, and there's like 9 million people that live in the state of New Jersey. I get it, but we're analyzing the data that we have to work with. Imagine if more people got tested, how many people would actually say, oh, surprise, I have COVID. I didn't know that. Yeah, some COVID can be a lot of different things, and as you can see here, I mean, again, it's an increase in testing. It's not a lot of testing, but it's a 9% positivity rate increase with 150 tests versus 131. Let's go somewhere down south now. What's going on there? Check this out. Georgia, 12.7% positivity rate versus 8.9%. That is up 3.8% total test. 166 versus 158 testing up, positivity rate up. It is a rise. Florida, we've been watching some wastewater sites rise, and you can see here, Florida, 17% positivity rate. The prior week was 14.8%. That's up 2.2%. However, in Florida, testing actually went down. It's 547 versus 568. I mean, it's not a big drop, and they do more testing. So I think it's a combination of both here, just because we do know that the South wastewater it was starting to rise a little bit. Texas positivity rate, 15.3% this week versus 13.6% last week. Difference of up 1.6%. Total test, 622 versus 645. Your testing's down, and for the moment, I think we can safely say maybe it's because of your testing. Let's go out here to Kentucky, because we never usually get much data out of Kentucky, and wow, this is relatively concerning. There was just a major golf tournament, PGA Tour, I believe it was. I was watching it yesterday. I'm pretty sure that was in Kentucky, right? Take a look at this. 20% positivity rate, 11.1% last week. That is up 8.9%, and testing is up a good bit, 50 versus 36. Again, small amount of testing, but it is a legitimate rise. Let's go out to the West Coast. California. Your positivity rate is 20.7%. The prior week was 15.4%. Difference of up 5.3%. Not really that much of a difference in testing. 179 versus 182. I'm going with this is a legitimate rise. I mean, 5.3%, and it's only 3 tests less. What's going on in the state of Washington, and then we will move on to a look at some wastewater sites. 27% positivity rate this week. The prior week is 18.5%. And yeah, that's up by 8.5% total test. 74 versus 54. It's a legitimate rise. You get the theme here. You know what? Let's do one state that's actually in the green. We haven't done one. And that would be, no, can't do Louisiana. Current week, that doesn't make any sense. Ohio is in the green. All right, Ohio, 10.3% is versus 20.4%. Difference of down 10.1%. 68 tests versus 54. So you are dropping at this time. The reason why we really couldn't look at Louisiana, 0% positivity rate this week. That versus 12.9%, and yet 26 versus 31. So no one tested positive at Louisiana. Okay, I mean, that's just doesn't really make much sense to me. I do need to refresh this wastewater scan page, if it will. Sometimes it does not always refresh. I want to make sure this is up to date. This is pretty much where we left off yesterday on wastewater scan, and we were just talking about Ohio. Let's see if they're seeing any rise in Akron, Ohio, in wastewater, and they are, which is disagreeing with what we just saw at Walgreens. So Akron, Ohio, is seeing a rise in COVID wastewater. RSV is low at this time. Influenza A is low. Influenza B is low. HMPV is rising. Norovirus is still moderate, but dropping at this time. 2 detections of Mpox and some hepatitis A detections. When we're dealing with such low testing at Walgreens, again, how many tests did they do in Ohio? 68 tests this week. Sometimes in those cases, wastewater is a better detection. Mind you, this is just Walgreens testing, not including at-home tests, not including CVS, urgent care, anywhere else, a hospital. So sometimes the states that are doing like really tiny amounts, we have to look at wastewater. And I would say with wastewater in this case, at least in Akron, Ohio at the moment, wastewater suggests, no, you're actually seeing a rise at the moment. Let's go somewhere else in the United States, then we are going to move on. Let's go out to California. How about we go up to, Let's see if there's an update on what we've been watching in San Francisco at this time. Remember, we were starting to see there be a rise in San Francisco. Look at this. I believe this is the wastewater. Well, there's two San Francisco sites. We'll look at both of them. This one is Oceanside, 250,000 population. Remember, it was rising. Now all of a sudden it's corrected. It's dropping. Low RSV, low influenza A, influenza B is low. Rising for HMPV. Norovirus is flat at this time. It's just two detections of Mpox and hepatitis A. What's going on at the other wastewater site in San Francisco? I want to know. Let's take a look here. The other wastewater site, okay, there is a slight rise. This is a much bigger wastewater site, 750,000. But again, it's not a big rise, and it is good to see the other wastewater site dropping at this time. RSV is flat at this time. Influenza A is not rising. Influenza B is not rising. HMPV is flat. Norovirus is rising ever so slightly. Just a couple detections of Mpox. And we can see here that hepatitis A, wow, loads of detections of that. All right, let's take a look at the latest variant from the CDC. We'll come back to that influenza map. Here's the latest variant from the CDC, and that is the KP.2 variant, which is at 28.2%, and JN.1, which caused the winter surge, is at 15.7%. Epidemic status, it is growing and likely growing in multiple states now. So we got wastewater, we have Walgreens data, we have epidemic status, all showing increases in several places. I think at this point we have to say we're at least entering a rise in the United States. Will it be a bump in the road? Will it be a full wave? That remains to be seen, but at this point, we're not in a lull anymore. We are definitely starting to see a rise now, and it is something we have to take serious. Memorial Day weekend's coming up. I don't recall us having a surge going into Memorial Day weekend, so we'll have to see what happens. Past several years, Memorial Day weekend has done a bunch of nothing. That really hasn't given any rise, but it really didn't cause us to drop anymore. It's been 4th of July. Post 4th of July is where we have been seeing a big surge. We are in uncertain times right now, and it's something we really have to pay attention to. Hospitalizations in New Jersey. Let me refresh this because I'm pretty sure that is yesterday's number. Here's today's number. Hopefully we have more hospitals. One more hospital. 58 out of 70 reported. Hospitalizations, 144. 8 people on a ventilator. And the ICU, 17. Discharges, 17 at this time as well. New York State, 599 new cases. That's high to start the week, or higher to start the week, so that's something we have to be mindful. Hospitalizations in New York State, 448 and 41 people in the ICU. We will start a new week with New York State tomorrow, where I do suspect we're going to see some sort of an increase. I don't think it's going to be big. If it is, that's concerning. But I think we're going to see some sort of an increase in hospitalizations, just simply because there have been that slight increase in cases that has been going on. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. We'll have another one tomorrow. We'll have the Tuesday edition tomorrow. If you learned anything, let me know down below. I'm curious to know. And of course, if you did learn anything, subscribe to my channel down below. Give this video a thumbs up to help push it out throughout the algorithm. And share these videos with anyone you know. And leave your comments down below. Let me know. Are you concerned about the rise that's not only going on in the United States, several places around the world? We've talked about France lately. Today we talked about France and Spain. We've also recently talked about the UK rising. Singapore is rising. Several different places. You know, there's a couple sites up in Canada where it says, oh, wastewater is rising. And especially here in the United States, of course, where, you know, we're headed for a holiday weekend pretty soon. I really honestly don't know what's going to happen going forward. I was thinking it would be a bump in the road, but who knows? You just saw Walgreens. Walgreens is definitely starting to rise now, and more people are feeling the need to go out and get a test at Walgreens. And PCR testing, it's not covered by all insurances. It can be expensive. Most people nowadays use these at-home tests right here. So, yep, we are in uncertain times. We'll just have to watch this as it unfolds, and of course, we will report on all of it, and we'll be on top of this. Alrighty, folks, see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Monday afternoon. Thanks for watching.